thing. And then the next year we did fertility, and we did women's organs, and we talked about, they have a woman averages 40 abortions in a lifetime, and very shortened lifespans, a lot of infection, that kind of thing. And we were able to go to the hospital and see where they actually did these abortions, and it was just horrific, very primitive. It looked like a dental chair that was worn, and that they just used a suction to do this, to perform this. And so we talked about how you could figure out when you were fertile and when you weren't, and how you could kind of map that out so that you could choose more of when you would be having any activity with your husband to avoid maybe getting pregnant. So it was interesting, and we were able to bring pictures of the fetus at different stages so that they would have an idea of what was going on in their abdomens, and see that this is actually a real life, a real child, or that kind of thing. And it was just astounding, their responses to this. It was astounding, and it was an amazing thing to see. I felt good about it. They divided themselves up into little groups according to age. So the the teenage women were together, and the childbearing women were together, and then the older women in their black scarves and black dresses were together, and they would sit in circles, and they would look at the pictures, and you'd hear them whispering and giggling and pointing, and that was but the older women were just astounded, and their eyes were big, and they were talking among themselves, and it was really an amazing time.